how's your day been? Mine's been rocking awesome, solid. So I figured I'd come in here and blow off some steam and shoot a video. So I'm going to go over a patient that I saw yesterday, eval. Knee pain patient, was, I think, diagnosed with meniscus tear or something like that. So I'm going to go over her plan of care and what that would have cost if she went back to the person that gave her this information. And I'm going to go over what we did with her, which is why she didn't go back to the other person, and see what you think about this. Patient comes in very active. She does hot works several times a week. She does, she swims like 4 or 5 days a week. She goes to the regular gym. She's constantly doing something, very busy, in good shape, very frustrated with this knee pain that she's having that's limiting everything that she's trying to do. So came in, referred to us by a patient of ours who also had knee pain that she swims with. And I guess she was talking about how her knee was hurting, and she saw our patient doing the warm-up stuff that they were doing and said, why are you doing that? And they said, well, I got this from my physical therapist, who's different than regular physical therapist, and this really worked for me, and it's fantastic. Oh, by the way, how's your knee been? Oh, not good, but I just went to this guy who went to the guru, and I'm not going to tell you what she said it cost, because I'm going to wait to see if you can figure that out at the end here. And my patient said, well, before you go back to him, go try my guy. You can do a free consultation. He'll run you through what he would do with you and at least get a second opinion. So she said, okay, I'm totally open to it. So came in for the free consultation and of course stayed, just like 99.999% of people that sign up for free consultations. And she brought this in and I saw the logo on it and I was like, okay, she went there. I wonder what that guy said. So, talked to her about her situation, and this knee thing really flared up while she was in Italy, hiking, walking for, I think it was 10 to 14 days, something like that. Came back, knees swollen, blown up, uncomfortable, very frustrated that she had to put up with the pain that she had on her trip. And but fortunately, she saw this guy before she went on her trip, and she was able to get her custom-made orthotics before she went on the trip, even though she's never had those before. And guess what? Her knee drove her crazy on the trip, which I don't know how that could happen because orthotics are supposed to fix that. Head scratcher, I know. So as I'm going through what I'm doing with her, and this is just the free consultation portion, so I'm going through and treating things, testing and treating things, not telling her what I'm going to do because I don't want to bias her. So after I get done treating 2 or 3 muscles and she's like, what are you doing? Like I can't, like I have a lot of pain and discomfort and I can't stop you the first time you do it. And then you come back and do it the second time after you do like nothing. And all of a sudden I can stop you and I don't have any pain anymore. So break down what I did with her. Said this is, the physiology behind it, and because I can tell she's a smart person, and she's like, oh wow, that makes a lot of sense. And I said, so I saw you brought in the paperwork from what's his face. Can I take a look at that? She goes, oh, I brought that in and you can keep it. I have a feeling I'm not going to be going back there once you get done here. And I said, okay, well, what did he tell you had? And she said, well, he said that I had, a meniscus tear and that my joint is pretty beat up just from, everyday use activity type stuff. And so he gave me that plan over there. So I went and looked at the plan that I'm going to show you here in a second. And I just looked at it and just started laughing. And she said, is it that bad? And I was like, yeah, like when you walked out of there, did any of this make sense? And she's like, not really, but I had heard other people that went there and said that, it really helped after a couple months. And I was like, that's what everybody says, because what this guy does is he throws you on a bunch of crap for the first month. And when that doesn't work, then he changes gears and goes to another bunch of crap. And when that doesn't work, he changes gears and goes to another bunch of crap. So by the time you're in there for 3 months, and show you here in a second how much that'll cost you, you're probably better off not doing anything because you're probably just better from just time. And she said, okay. And she said, well, how long do you think you're going to see me? And so I was done with the free consult by that time. I said, well, stand up, do a single leg squat, do a double leg squat, stand on your heels and toes, all the stuff that irritated when you came in. She did all that. She's like, well, that doesn't hurt. And that feels really strong and stable. And I was like, okay, well, I might need to see you like one more time this week and maybe once next week. She said, seriously? And I was like, yeah, because remember, this is your problem. This is what I did. This is why you feel better now. This is why you function better now. Okay. So now let's compare what I did to what this dude gave her. So after very little assessment, so I asked her, what the assessment was. Very, very minimal assessment. Of course, take pictures, because this guy is a DO and a physician who used to work for the biggest orthopedic group in town, who all are just a mill. After he showed her the pictures, which gave him the diagnosis and her pointing to what hurt, and then he said, this is what we're going to do. So this is the advanced treatment protocol that he came up with for this patient. And when I look at this, I laugh. And the reason why I laughed is because when you look at these, so we're going to do all three of these things every time she comes in. So radio frequency therapy, which restores movement and increases blood flow and decreases inflammation. I guarantee you're not going to find anything that says that. Piezoacoustic compression therapy. When I read the description of piezoacoustic compression therapy, I find out that it's ultrasound. This is ultrasound from 1970s that we knew in the 1980s was absolute horseshit, that this guy is going to charge a lot of money for, which treats tendinopathy, trigger points. Trigger points don't exist. Why would you treat tendinopathy when the tendon's not the problem? Achilles tendinopathy, another tendinopathy. Plantar fasciitis, why would you treat fascia when fascia is never the root cause? And then optical laser therapy here at the bottom, which also treats plantar fasciitis, tendinopathy, muscle strain pain. So in this up here, this one treats muscle strain pain, chronic pathology. So basically he's got three different ways to treat the same thing that he's going to do every single visit. So if one of these worked, why wouldn't he just do one of these? Oh, that's right, because then he would only be able to charge for one of them instead of 3 times what he's going to charge, okay? And at the end of the day, this is all fuckery. High level, absolute fuckery, okay? So also what this guy does is puts people in orthotics, also tells them rest, don't do anything, also loads them up on supplements that he sells there. So it's a real wing dinger. So now I know what you're wondering. What was the plan? How often was she going to have to come in? What's this going to cost? Well, it's only going to take 8 visits, and the 8 visits are going to take 50 minutes apiece, because you're going to be on each one of these machines for 10 to 15 minutes. And it's only going to cost $2,160. That's $270 a visit to have fuckery done to you over and over and over again, after she already bought a couple $100s in orthotics. And I'm assuming she's going to have to buy some supplements along the line in this rigmarole here too. So this is what people are being sold, and this is what people are paying. I have people that see this guy all the time that come in and say, I had one guy that came in with hallux rigidus, who his plan was $6,000. $6,000 for hallux rigidus and a little bit of plantar fasciitis that we wiped out in 3 visits. And no, I didn't charge him $2,000 a visit so I could make $6,000. No, that's not what we did. So if you have patients that are going to see these people, look at what they're doing and break this down, okay? You should be able to see here that this is absolute bullshit. And you should be able to stand up for your patient and say, don't do this. Like I have no problem hurting people's feelings. So when she said, well, I don't want to hurt his feelings, I was like, why not? This guy's charging people between $2,000 and $6,000 to get screwed over and spend 8 visits with them to get nowhere. So in a free consultation, I got this lady probably 75 to 80% better. She's going to come back. Yesterday was, what is today, Wednesday? She came in on Tuesday. I think she's coming back on Friday. I told her to go to HotWorks and go work out and do whatever she wants to do in between then, so she can test it out and see how what we did holds up. Because we rarely ever say don't do anything. We always, or nearly always, say go do something, go do more. All right. So when you get people that are coming in doing this stuff, or if there's people that you work with that do this, or worse yet, you do this because you don't know what else to do, it's time to call bullshit and be a legitimate clinician. So when you get people bring this shit in, call it out. You should be hurting people's feelings when they're ripping people off. And if you're somebody who's ripping people off and you know you're ripping people off, but you don't know what else to do, Get in contact with me. I will help you out so you don't look like this guy and start ripping people off doing this shit, because eventually this guy's gonna get exposed. And all of those people that wasted their money, he's gonna have to walk around town with all those people looking at him saying, you screwed me over because you knew I didn't know any better. Don't be that guy.